Our 105.7 WCRK FM Steelers Wheel. It's Ed Arnold. Jacqueline's back with me in just a moment. We got a special guest in the house, our partner, Dr. John Milligan, Milligan Vein Clinic. Good morning, sir.
Good morning, and thanks for having me.
Well, I really been hearing your commercials and curious about this because at some point, myself or someone in my family is going to need your help at Milligan Vein Clinic, I'm afraid.
It's a very common disease. By the age of 60% of the female population actually have the leaky veins. So as we age, I don't know if anybody's looked in the mirror, but everything starts to droop, sag, and stretch. Well, your veins do the same. And when they stretch out enough, your directional flow valves blow out, and then gravity wins. So
how do we clean that? How do you, and without getting too technical, I guess, the layman version for us that maybe not understand all the procedure, how do you clean that up? Or how do you correct that?
So in essence, it's not really cleaned up. The stuff I deal with is beneath the skin, and you can't see it. So I use an ultrasound machine to look in depth and see the directional flow. And when I find the flow going in the wrong direction, I, in essence, weld the vein closed to force your body to reroute it to a healthy vein.
Okay, gotcha.
So when people think of veins, they commonly think of cosmetics. Oh, I don't like how my legs look, but it's really a medical condition. When you look down and see your ankle swollen at the end of the day, if your heart's good, then most likely that's coming from your veins.
Wow.
And at night, at the end of the day, your legs are heavy and tired, and 5 years ago they weren't that way. That's commonly related to veins. As the day went on, you build up fluid in your legs. Your legs get heavy, tired, achy. You lay down at night, you'll get horrible Charlie horses and cramps. You'll even have restless legs, and that's your body's way of saying, pump blood through me and give me some oxygen and groceries.
Well, and that's a great way to say it. And, you know, we think of it being, like you said, cosmetic for ladies, but for us guys, if we're having restless legs, I got our engineer, I won't tell him too much, but Frank has restless legs at night, and he's been trouble. So that's a part of this?
That's part of it. So basically, there are two types of restless legs. One's related to your neurons and nerves not working appropriately. The second one's related to your veins, and you're not getting enough circulation, so your body subconsciously moves your legs to pump the blood through them.
Wow. There's been, obviously such a demand for it because you have 3 clinics. I was impressed with that. You're from Jefferson County, and you have a clinic out in Crossville and a big senior market there, but even people my age need the treatment there in Crossville, and then you're in Knoxville right in here now.
Correct.
So that's a busy guy.
Yeah, it's, was it no dust settles on a rolling stone?
That's right. Well, anything else that someone listening may not know, doctor, that needs to know about what you guys do and what you can do?
Well, it largely runs in families. There's a lot of genetic predisposition. Your elastic tissue within your veins. Some people are elastic man and they stretch out too much and their valves don't work.
Right.
And you'll have entire families where they'll remember grandma had varicose veins and brown legs and grandpa had sores. Well, if you're having the aches and cramps or starting to develop varicose veins, it's largely a genetic component.
Okay.
The sooner you treat it, the less permanent damage you have done.
Well, thanks for all you're doing to help people. And that really is a great business to help, people needing this.
If people remember back to grandmother having their veins stripped, this is minimally invasive. You're in and out of the office in usually under an hour.
Wow.
And you're back to work the next day.
That's incredible, because I was thinking that was a day or two recovery.
Oh, yeah. Grandma was in the hospital for a week and, was in a lot of pain for weeks. But now, literally, you're back to normal activity within 2 or 3 days.
Wow. Well, thank you so much for the information. This is educational, sir.
All right. Well,
it's
thanks
good
for
to
having
meet you.
me.
And thanks for partnering with us. Again, Milligan Vein Clinic, Google them today and get that appointment.